Good afternoon. My name is Dr. Sanjay Suresh, and I'm a student at University of New England taking the prerequisite Pathophysiology Bio 1030. So today in my video, I'm going to be talking about nephrotic syndrome. So what is nephrotic syndrome? Nephrotic syndrome is a disorder of the kidney where the kidney excretes too much amounts of protein in the urine. And this is caused by damage of the small blood vessels in the kidney, which are responsible for filtering excessive amounts of waste and water. What are some of the clinical features of nephrotic syndrome? So nephrotic syndrome is a main disorder which affects small children. So when we see a child who is suffering from nephrotic syndrome, we see puffiness of the face, swelling of the eyelids. Also, we see puffiness of the abdomen and legs, weight gain, edema, and on examination, we see foamy urine and oliguria. So, what are some of the disorders that may be related to the nephrotic syndrome? So, nephrotic syndrome is seen in the kidneys. So, a couple of disorders that I'd like to talk about is the nephritic syndrome. What is nephritic syndrome? Nephritic syndrome is the inflammation of the glomeruli, it's the swelling and inflammation of the glomeruli. Which could be related to conditions like hematuria. So when we see a child who has nephritic syndrome, we see hematuria. What is hematuria? Hematuria is presence of blood in the urine. We also see hypertension and we see edema. This is one disease that could be differentially diagnosed. We don't see hematuria in a nephrotic syndrome patient. The second disorder that may be related is glomerulonephritis. This is caused by beta hemolytic post-streptococci. And what happens here is that these bacteria interacts with the antibodies, and this forms immune complexes which get deposited. And this could also be associated with the acute rheumatic fever, which is seen in the heart. So what happens is these immune complexes, they get deposited in the glomerular basement membrane, leading to similar features like sore throat, joint pain. Also, you could be seeing hematuria and etc. Hematuria, hypertension, edema, conditions like this. So this is related to the glomerulonephritis. The third disease that I'd like to talk about is UTI. UTI is an ascending infection of gram-negative bacteria such as E. coli and Klebsiella. And UTI is a common disorder that is seen in elderly people. So what do we see in the UTI? We see fever, dysuria, abdominal pain, chills, and then fatigue, things like this, and they have difficulty to urinate. So these are three syndromes that could be differentially diagnosed from the nephrotic syndrome, and they are related to the same system in the body. Now coming to the diseases that are related to nephrotic syndrome. So nephrotic syndrome, the main thing that we said is proteinuria. That means excess amounts of protein in the urine. We also see edema. Edema is accumulation of fluid. Mainly it is seen in the legs. So when we do a leg examination, we can see pitting edema. We can diagnose that this child may be having a nephrotic syndrome. The next most important disease that is related to nephrotic syndrome is focal segmental glomerulosclerosis. And this is mainly the scarring of the tissues, which could be secondary from an infection. And this focal segmental glomerulosclerosis could be caused from conditions like drug abuse, diabetes, HIV. It could also be seen in sickle cell disease. And this is the main feature this is a main disease which could be related to nephrotic syndrome. The second and the last disease is the minimal change disease, where you see low amounts of protein in the body because the protein gets because a lot of protein gets excreted, and you could be seeing high amounts of cholesterol and triglycerides. And on the histopathology, you won't be seeing much findings except lot of lipid content. So these are the 4 diseases that are related to the nephrotic syndrome, and they're the main features. They occur together. So I hope you liked my video, and if you do like my video, please do subscribe to my channel. Thank you for watching.